First of all, there is scientific documentation that if you beat up the body physically on a regular basis, how do you do that? Sports, law enforcement, military. You're constantly jerking the body, either because of the kind of exercise you do or because you're playing against someone in football and basketball and hockey and all these things. So what happens is, every time you jerk the body, you disturb the blood supply to the pituitary. And that eventually can lead to less production of growth hormone and testosterone. Because don't forget, pituitary gland is the master. It's like you have something called the endocrine system. The endocrine system in the body is the combination of organs that make hormones. So why do they call it endocrine? For example, you have saliva in your mouth. That's exocrine. It comes from a gland, but the gland produces it in a duct and it comes out. Same with your pancreas and gallbladder and liver. There's like many, and vagina and many places produce something, but it comes out. That's called exocrine. Exocrine means to the outside. Endocrine is to the inside. Now, whether the origin of these words is Greek or Latin, I don't know. The point is, you have this whole system on the inside, because what they all have in common is the chemical they produce, they immediately put it into the bloodstream. It doesn't come out or go outside any place. It goes directly into the bloodstream. So any organ that makes a product that goes into the bloodstream is called endocrine. Now it so happened that all the organs around the body that make endocrine products are hormonal organs. And there is one like the conductor of the orchestra, the master of all of them, that's the pituitary. And so therefore the pituitary is connected to the thyroid, the parathyroid, the thymus, the pancreas, the testicles, the ovaries, the adrenals. So any organ that's endocrine, the pituitary is sitting on top of all of these. And it makes a stimulating hormone to all these places. For example, there are two hormones from the pituitary that go to the testicles. One to stimulate production of testosterone, the other to stimulate production of sperms, because that's what the testicles do. Testosterone, the hormone, and sperms. So yes, if you disturb the pituitary blood supply, and then you're going to start making less of certain hormones, the most vulnerable is growth hormone, but then you can also affect sex and other things. So here's how that works. You get a football player, when he first signs up, all his hormones are normal. And then a few years after he's been beaten up pretty good, many of them are going to have low testosterone, low growth hormone. Now here's the deal. So let's say at 5 years, here's one guy who now has low testosterone, growth hormone, but when he plays, he's competing with the guy that just signed in, which is an unfair competition. So this guy does need hormones to bring him up. The only catch is, it's got to be handled by someone like me who understands all this stuff. And part of, by the way, it's in the book, part of that is, I want everybody in sports, amateur or professional, law enforcement, military, to have their hormonal profile checked when they come in, and then check it once a year after that. Because sooner or later, you're going to find that some of these people have lower hormones than when they started. Of course, in the military and law enforcement, my recommendation may never be taken up because it will cost the department too much money. They're not going to be interested in doing stuff like that. But in the sports, that's a minor expense. So my recommendation is, let's even limit it to sports. Do the hormonal profile every single year, but start with baseline when the person signs up. And then have a doctor who understands this business, like I am, to monitor this stuff annually. And when somebody has evidence that their hormones are coming down, then give him the stuff, number one, in physiological amounts, not by the ton. Number two, it's out in the open. There's no reason to hide it. So ideally, that's what should be done. Olympics, professional stuff, that's what really should be done. Not only that, the ones that take it blindly, aside from being illegal, and they're being accused of being dishonest, because we're like, there's unfair competition, you know. There would be none of these issues. It would be legal, it would be ethical, it would be natural, it would be proper. Because yeah, some of these people knock themselves out enough. Another thing, by the way, if you ever have a head injury, where you suddenly lose consciousness for a few seconds, which happens to many people with a car accident, many falling down, getting hit with a ball, especially a baseball is like a bullet when it hits the head, or a hockey, it hits the head one time. In many of these people, as of that afternoon, you begin to make low growth hormone. At any age, you could have been hit at 25, at 30, at 35, it doesn't matter. When that happens, that shakes up the head so bad that you're going to start making lower growth. Now, there's no doctor in the whole universe who's aware of this little fact. And I was one of them. When I was doing surgery, people come in, car accident, bleeding to death, jump in the operating room, save their life. Now they're in intensive care on a breathing machine and 10 different specialists. And maybe some bones broken, so the orthopedist is also in on the case. Okay, so finally that person has been saved and now he's going home. And of course he has appointments. He has to go see the cardiovascular surgeon at least a couple of times, the orthopedic surgeon maybe a lot more visits. But nobody in the whole world thinks about check his hormones. It's just not done. And yes, this guy is going to be fine as far as fixing his broken leg and lung that was bleeding him to death, that's been fixed, and all the other things. And now he's going to recover, which takes 6 weeks. Any insult to the body takes 6 weeks to recover from it, so to go back to baseline. But once he's recovered and he's back to baseline, his life will not be the same, because with low testosterone and low growth hormone, he's going to have a lot of other symptoms. But it's just not, this is something that's never looked at or thought about. And yet there are endocrinologists all over In fact, when I was doing surgery, the slightest sugar problem in a hospital patient, immediately call endocrinology consult, because I don't want to mess with that. So you usually end up having 6 or 10 different consultants on the case. Not only that, it's also legally safer, so that you're less likely to make a mistake. There's a sugar problem, get an endocrinologist. The guy has a little fever, call infectious disease to handle it. He's on a breathing machine, pulmonary internist. So everything has a consultant. So you've done the operation, and he's still my patient, but I have 10 consultants on his case. This is how we practice in the hospital setting. And even though I never thought about it in a legal way, it just works out that way, because I really don't have the time or all the knowledge that, say, an infectious disease doctor has in deciding which best antibiotic to use for this guy's possible infection. Pulmonary internist handles the breathing machine as long as the person has got that help, that he has the breathing machine. Sometimes he's on it for 2 days, 4 days, 3, depending on the problem, of course. But I don't want to mess with it. I've done my part. And I see that patient every day, but only to make sure that everything is fine. But the minute-to-minute management on the breathing machine, on the fever, on the sugar that was a little high, These are all consultants, and they come in, they take care of these things. So that's, but, so there is already an endocrinologist on the case. Well, do you think he knows anything about the fact that this guy had a head injury when he first came in, and therefore he's going to have low growth hormone when he leaves? It's just not thought about. It's just really unbelievable. It's almost like,
these become afterthoughts.
A heavenly revelation that this thing is happening. Another huge area. See, growth hormone strengthens the immune system in a very powerful way. And how do you see that? Okay, you see it in several areas. One of them is many clients complain that when they exercise a lot, it takes them a long time to recover. 2-3 days, they are sore, they're stiff. That's immune system. Another way it should, so when you take growth hormone, the recovery time becomes faster or closer to normal. Another area about the immune system is anytime you take enough growth hormone on board and you have an injury, including surgical operations, the recovery is a lot faster in a very clear way. And I see this way. I call up a client, because now he has new blood work, and I want to see how he's been doing the last several months, and to discuss the current blood work with him. And then he'll say, and it never fails, you know, doctor, I had to have surgery on my spine, on my hip, on my abdomen, any major surgery. And the surgeon couldn't believe how fast I recovered. Yes, sir. Growth hormone is doing that if you have enough of it on board. And then another aspect of this is, like, let's say you're flying and people are sneezing on the airplane or some confined space, you have less tendency to catch that bug. It can still happen. It's just that you have bigger immunity than the next guy. And then tangentially, another possible connection is some people will say, you know, when I get in the gym, it's so easy for me to hurt myself. I pull this, I'm doing some exercise, and then I pull this muscle, or I have severe pain in this, or if I'm lifting something, repetitively, then I suddenly have severe pain in my shoulder, or tear a muscle. Well, yeah, these things are related too, because it's the immune system. So from the immune system standpoint, another area which I'm beginning to really push, because I'm telling you, I am now very involved in the house, used to come here, the daily endocrine briefings, where I get the latest on hormones and related health items, and then all these big places, and sometimes it's newspapers like happens to be written in the New York Times, Boston Globe, LA Times, Wall Street Journal. And then very frequently there is a place to respond at the bottom, whether you're a physician or not, to that particular topic. And I put in my 2 cents worth, and they review it, and the next day I get an email that it was accepted. And of course I'm copying all these things in case you want to see documentation. And what I'm saying is, everything I'm saying relating to all these subjects, gaining weight, losing weight, hormones, diet, eating right, my input on all these subjects is always accepted, which tells me that what I'm talking about is right, is where it's at. And then one of these items, which is the latest thing, is this. Many nasty medical conditions are classified as autoimmune diseases. Like something is weird with the immune system that's allowing this to happen. So multiple sclerosis is one of these. Crohn's disease, which affects the intestine, and that's a real miserable disease. Rheumatoid arthritis, and there are several others, are all considered autoimmune diseases. Okay. So for all these diseases, the expert doctors give certain medications. Of course, MS is mainly neurologic. It affects the nerves and the brain. Crohn's is bowel or intestine. Rheumatoid arthritis is joints. Okay, so now when you give the regular medications for all these conditions and it's not really working too well, so then you're thinking, well, now let's try something really formidably powerful to see if it can help. Well, the only thing most people think about is chemotherapy, drugs, which are absolutely toxic. And even if they help in somehow containing the disease, they're going to hurt you in many other parts of the body. Just like someone who has a cancer, you put them on chemotherapy, they lose their hair, they're nauseated, they don't feel like eating, and they look horrible and they feel horrible all day long. So that's the trend right now. For all these diseases, the treatment is not satisfactory. Come on, let's use some methotrexate, some Remicade, some azathioprine. These are all chemotherapy drugs. But there is also some research, not as big, that's showing very promising results using growth hormone in a little bit larger dose than average. And that's where I come in. So now I'm putting this out, and it's getting accepted, that instead of using toxic drugs that are going to make a person feel horrible, why not put him on 6 months of growth hormone and see if he can make it? Not only that, I have some clients at AAG who already have a few multiple sclerosis, a few Crohn's disease. I don't remember if we have any rheumatoid arthritis. And they've been doing fine ever since they got on the hormones. But don't forget, I don't give anybody any hormone because I think it's going to do good things for them. My main determination is, does that person have less hormone than what they need? That's the main determination I make. And if it looks like they have less than what they need, then I recommend that they take it. Of course, once they take it, it has a million benefits, but that's not really why I give it. I give it because they need it. Do you get the slight difference here? Like sometimes, especially in this practice where I have some cosmetic cases, mostly women, so, you know, you think I should take growth hormone? Because I have a friend that when they took growth hormone, their skin was nicer and they had, like they looked younger, less wrinkles in the face and stuff. I say, you know, I don't give it to you because it's going to rejuvenate your skin. I give it to you only if I feel that you need it, that what you have is not as big as it should be. And yes, it would have this good effect and a million other good effects, but that's not why I give it to you.